because upper limb and lower limb are for functional purpose, and lower limb is more important for locomotion. Alright? All of you know hip bone. It is made up of how many parts? 3 parts. Ilium, pubis, ischium. Ilium should be above, pubic should be pointing forwards, ischium should be backwards. Here,
Yep.
or on the posterior. So ilium, pubis, ischium. Alright? All the 3 will meet at this particular area. This is the acetabulum. Clear? So the cartilage that is formed here at the acetabulum is called the triradiate cartilage, because when 3 bones meet together, in between you will have cartilage. That cartilage is called as triradiate cartilage. Very similar to symbol of a Mercedes Benz. Clear? So it's triradiate. Alright? So that can be a question also. What shape of cartilage is here? Then you can say it's triradiate cartilage. So acetabulum is the meeting point for all the 3 bones. Alright? Okay. Next, what happens here is, let us look at the side determination. Acetabulum should always be on the lateral side. Because you will have the femur coming and articulating. So it cannot be on the medial side. Alright? So holding the acetabulum on the lateral side, put the pubis to the front, ischium to behind, it belongs to that particular side. Understood? The more easy thing is, look at the sciatic notch, alright, which we will see. This is the sciatic notch. Put the space between the index finger and the thumb into this, and put your palm on the acetabulum. That side is the side of the bone. More easy. Understood? Got it? Okay. Clear? Usually I don't ask side identification for bone for MBBS, but still. Okay. Now you know the 3 important bones, where they meet, and side identification. Alright? Now let us look at the ilium. What are the important features? Ilium is a fan-shaped structure, that it is almost flat. It has got a lateral surface, medial surface. This is the lateral surface, this is the medial surface, and then it has got a upper border. This upper border is called as the iliac crest. What is it called as? Iliac crest. Okay. When I ask, you have to say it loud. Alright? Like kindergarten kids. Together you have to sing songs, nursery rhymes, right? This is iliac crest. You have a lateral surface. This surface gives attachment to gluteal muscles. So this is called as gluteal surface. What is this called as?
Gluteal
surface. Understood? The medial surface, you can see part of it is very smooth and part is very rough. Clear? This rough part is called the auricular surface. What is it called?
Auricular surface.
And this smooth part is called the iliac surface. This is called iliac surface because iliacus muscle is attached here. Got this? So this is iliac surface, this is auricular surface. This auricular surface is always very rough, and this articulates with the sacrum, forming sacroiliac joints. This is smooth, and this gives attachment to iliacus muscle. We won't go deep into attachment of muscles or other things, but important points I'll tell you. Alright? Understood? Okay. So iliac crest, gluteal surface, iliac surface, auricular surface. Clear? Okay. If you look at the iliac crest, it is nice and curved, and it is convex. It has got an anterior end. See, this is the pubis, right? So this is the anterior end. It has got a posterior end. This anterior end, you can see a prominence here, right? This prominence is the anterior superior iliac
Iliac
spine.
spine.
This is a very common and most commonly asked landmark, even during surgicals. Why it's important? Okay, someone told sartorius. Yes, sartorius muscle takes origin here. The other important thing is lumbar puncture is always behind. Other thing is inguinal ligament is attached here. Understood? So this is anterior superior iliac spine has got lot of importance. One is attachment of inguinal ligament, attachment of sartorius muscle, and of course it is an important landmark for McBurney's point. All of you know what is McBurney's point, right? Yes, from umbilicus to anterior superior iliac spine, you draw a line. Clear? Medial 2/3 and lateral 1/3, the junction is the place where you get the base of appendix. That's the surface marking. So this is anterior superior iliac spine. Please make sure all of you know this. Alright, when you come down, you see another spine here. This spine is anterior
Inferior iliac spine.
Alright, similarly when you go back, you see a first prominence and a second prominence here. If this is anterior superior iliac spine, so this should be
Posterior superior iliac spine. Posterior inferior iliac spine.
Clear? More than the posterior iliac spine, anterior superior iliac spine is important. Anterior inferior is next commonly asked. Clear? Okay. This is iliac crest. Clear? Now if you look at the iliac crest from the angle, you can see at one place just behind the anterior superior iliac spine, you will see a bulge. Do you see this?
Yeah.
Clear? Yes. Yeah. Alright, so you have identified. So this is called as iliac tubercle. What is it called as? Iliac tubercle. So what is the important muscle that attaches here? Iliac tubercle, iliotibial tract.
Yeah. Tensor facility and gluteus maximus.
Everything looks Greek and Latin, right? True. Many of the anatomical terms are Greek and Latin only. So there's nothing wrong. This is iliac tubercle. So this is iliac crest, iliac tubercle, anterior superior iliac spine, anterior inferior iliac spine, posterior superior iliac spine, and posterior inferior iliac spine. This is gluteal surface. This is iliac surface. This is
Auricular surface.
Understood?
Yeah.
Alright. Now in this iliac crest, you have the attachment of all the abdominal muscles. Clear? Alright. Similarly, some of the posterior abdominal muscles also get attached here, like quadratus lumborum. All these muscles also will be attached here. Fine. Okay, if I ask you what are the important gluteal muscles attached to the surface,
Gluteus
you
maximus.
said maximus, I give only half a mark.
Medius.
Gluteus medius and minimus is more important, because gluteus maximus maximally gets inserted into iliotibial tracts. Alright? Fine. Next, let us go to pubis. Now, pubic bone is facing anteriorly, it is more pointed. The important features are it has got a body and it has got two rami. Body, two rami. One superior ramus, one inferior ramus. If you look at the superior ramus, it goes from pubic bone to IM, right? So what is the name of this? Iliopubic ramus. If you look at this one, this goes from the pubic bone to the ischium. So this should be called as ischiopubic ramus. Got it? So body of pubis, iliopubic Ischiopubic ramus. Now this body of pubis, it has got some important landmark. If you keep the hip bone like this part of the body faces anteriorly, right? So this is the anterior surface of pubic bone, body of pubis. Clear? Now what is important here is all the adductor group of muscles take origin here. Adductor longus, adductor brevis, and also a little bit of adductor magnus.
Yeah.
Clear? Then you have one more adductor, which is that
Longus,
I told-
brevis.
gracilis also takes origin from here. So if I ask you what are the adductor muscles or origin of adductor muscles, then you should say it is from body of pubic and ischiopubic ramus. Clear? Then body has got a posterior surface. This posterior surface is related to organ here. Which is the organ that is just behind this? Yes, which bladder? Gallbladder?
Urinary bladder.
Understood? So please make sure you tell the exact word. If you write bladder, yes, we know it is urinary bladder that is here. Right? But still, it's better to be specific. Though this surface is called the visceral surface, and here it is the urinary bladder that is related. So body of pubis has got an anterior surface where all the adductor group of muscles origin with organ attachment. Here you have the urinary bladder related. Then if you look at the medial side, you see a flat surface here. You see this? Yes, this is called the symphyseal surface. If you look at the pubic pelvis here, you see here, you have the two pubic bone coming together and forming a joint. This is called as pubic symphysis. Understood?
Yes.
So you have pubic symphysis. So this surface is called the symphyseal surface. Understood? Now what type of joint is pubic symphysis? Yes?
Should be fibrocartilage.
What type of joint is this?
Fibrocartilage.
You are near to it, but still. What type of cartilaginous joint is this? Anyway, just to revise, you have fibrous joint, cartilaginous joint, and synovial joint. Cartilaginous joint are two types: primary cartilaginous and secondary cartilaginous joint. Understood? When two bones come together, in between, if you have hyaline cartilage, that cartilage will later on ossify and completely form a single bone. For example, if you take the mandible, you have the ramus of mandible coming from both the sides. In between, you have hyaline cartilage. That's why it fuses and forms a single bone. Understood? So that is primary cartilaginous joint. Initially there was a cartilage, that was hyaline cartilage, and later it fused completely to form a single bone. But here pelvis needs to dilate during childbirth or due to any other tumor, anything expanding here. Understood? So for this, nature created another joint that is called as secondary cartilaginous joint, where you have two bones coming together and you have a cartilage in the center. But the cartilage is not hyaline, it is fibrocartilage. So anyway you have fibrocartilage, it will remain as fibrocartilage only, it will not become bone. Clear? So that is secondary cartilaginous joint. So this is called the symphyseal surface. Then it has got two other borders. It has got an upper border here, that's the border you are seeing here. Then it has got a small lower border. The lower border is very easy. If you look at it, ischiopubic ramus, lower border of pubis bone, once again on the same, both the sides put together, it forms an arch. That is called the pubic arch. Clear? That is one thing. The most important is always on the upper end. if you look at the upper end here, keeping it a little bit on an angle, and if you see, you will see a nice elevation. You see a nice elevation
Too
here.
much for that.
You see? This is called the pubic tubercle. What is it called? Pubic tubercle and anterior superior iliac spine are very, very important surgically. Why? Inguinal ligament extends from anterior superior iliac spine to
Pubic tubercle.
pubic tubercle. Understood? Pubic tubercle is an important landmark because inguinal ligament is attached there, number one. Number two, you have the superficial inguinal ring above and medial to the pubic tubercle. Then you have the femoral ring, which is below and lateral to pubic tubercle. Understood? Any doubts so far? Pubic tubercle. This is a very important landmark. Alright? Fine. So this you have identified. Now this small area that is just medial to the pubic tubercle here, you see the small area. This area is called the pubic crest. What is important here is you get the attachment of rectus abdominis muscle. All of you know where is rectus abdominis muscle, right? The muscle which is in the center, which gives the six-pack appearance, right? So it gets attached here. Pubic tubercle, pubic crest.
Family pack.
All of you are able to identify these parts: symphyseal surface, anterior surface, posterior surface, pubic arch here, pubic tubercle, and pubic crest. Fine? Okay. If you are fine, then let's go to the next component. If you face the iliac crest, it goes to posterior superior iliac spine. Then you get the posterior inferior iliac spine. Below that you have the greater sciatic notch. Because there is always something called as lesser sciatic notch. Here. So this is greater sciatic notch. If I ask you what is the clinical importance of this, what will you write?
Structures which pass through.
Okay, if I ask you what is the most important structure that comes out through this notch? Sciatic
Sciatic nerve block.
nerve. So what is the clinical importance of this? Huh? See, clinical importance of the sciatic notch is it is used to identify male or female bone in forensics. Clear? If the notch is small, then it is male. Clear? If it is very wide, then it is female,
Female.
because female pelvis has to be wider than male to accommodate the childbirth. Understood? Okay. So this is next. Many of the students, once if I mark this area and ask what is this part of the colored part of the bone or whatever it is, they always tend to say greater sciatic foramen. Never say greater sciatic foramen in the bone. Unless you have the sacrotuberous and sacrospinous ligaments joining here, then only you get the foramen. When the ligaments are removed and what you see here is only notch. Alright? Okay. Now watch carefully. When you come down the greater sciatic notch, see you get a prominence here. Right? All of you are able to see a prominence? This is called ischial spine. Ischial spine. Understood? Okay. Next, if you come down from the ischial spine, you get another depression here.
Lesser sciatic nerve.
This is lesser sciatic notch. Here, if you come down the lesser sciatic notch, you get the ischial tuberosity. I can ask you what is the clinical importance of this ischial spine, then you have to say it is important for landmark for pelvimetry, that is to measure the pelvis. Clear? See, you have two spine here, one ischial spine on the left side, one on the right side, right? The distance between the two should be more than 10 centimeters. Understood? Then only the head of the baby can come out easily. If it is less than 10 centimeters or less than 8 centimeters, the head of the baby will stop at that level and it won't come out. That is why this line is also called as station 0. What is it called?
Station 0.
Understood? So based on the head of the baby in relation to ischial spine, the position will decide at what level, what station the head of the baby is. Understood? Alright. Now this is ischial tuberosity. This ischial tuberosity is a very rough area, and the function of ischial tuberosity is to give attachment to hamstring muscles. Which are the hamstring muscles?
Semitendinosus, semimembranosus,
Semitendinosus, semimembranosus, and long head of
long
biceps
head of-
femoris.
yeah.
Is there any other hamstring muscles?
Adductor magnus.
Yes, part of adductor magnus. Clear? Very good. So all the muscles take origin here, except the short head of biceps femoris. Clear? Okay. What is the other importance of this bone? This part of the bone? See, when a person sits down, this is the bone that comes in contact with the ground. Understood? You guys won't know this because you are sitting on a cushion seat. Clear? Once upon a time, all colleges, they had only a wooden seat. Why? Because when you sit on this bone, you are always uncomfortable. There will be little nagging pain always here, so that you don't fall asleep. You'll always be alert. But unfortunately, since you are sitting on a cushion seat, people always feel drowsy. Right? Fine. That's true. So this is ischial tuberosity. Okay? Now let us go to the other important structure, that's acetabulum. And you have another opening here. Acetabulum has got three important parts. If you look at the acetabulum, you will see a nice C-shaped smooth part, and in the center you have a rough part. See here, a smooth part here and a rough part. Clear? Smooth part here and the central rough part here. Got it? Yes. This smooth part is the lunate articular surface of the acetabulum, because it is moon shaped, half moon shaped, right? So it is called lunate articular surface of acetabulum. So when femur articulates here, it will articulate only within that C-shaped structure. Understood? So this is called the articular part of the acetabulum. What is the shape? C-shape. Clear? Fine. In the center, it is rough, and I told you the femur articulates only here on the smooth area, so it does not come to the center at all. This is the non-articular part of acetabulum. This is the non-articular part of acetabulum. Clear? And this is acetabular margin. If you trace the acetabular margin downwards, on the lower aspect, you will see a small notch. Clear? You see a small notch. This is called the acetabular notch. Clear? This will be covered by a ligament, and you will have acetabular foramen. So there will be one artery going through the foramen here, and it will go into the ligamentum head of femur.
MCF here.
Clear?
Middle circumflex cranial artery.
Okay. Below this, you have this opening here. This is known as the obturator foramen.
Yeah.
What is it called?
Obturator foramen.
Three important points all of you should know here. Obturator foramen is formed between three bones. Clear? Okay, it's formed between the ilium here, pubic and scium. So it is formed as a round opening here, which is usually closed by a membrane called as obturator membrane. Understood? Point number one. Then you have the margin here around this obturator foramen. You have a margin that is outside here. You have a margin that can be seen inside also. This margin gives origin to obturator externus muscle because it is external, outside. This gives origin to obturator internus. If I color the
Internus,
bone
externus.
here and keep it and ask you what is the structure attached to this colored area of the bone, then you should know, first see whether it is inner or outer border. Clear? Once you know this outer or inner margin or border, then you should say what muscle is attached. Okay, I told you this is closed by a membrane. What is the membrane?
Obturator membrane.
Obturator membrane. So everything surrounding this is called obturator only. Okay? Now, is it completely closed or does it allow any structures to pass through? Does any structure passes through this? Yes, obturator nerve passes through this. Clear? Now, where does the obturator nerve pass? Now, if you look at the foramen from inside, on the uppermost part, you will see a small groove here.
Oh.
See here? You see a groove? This is called the obturator groove or obturator canal.
Cut.
What is it called? Obturator canal. So it passes through and comes up. Obturator nerve supplies which muscles? Camulus superior. See here. Yes, it's okay. See, I told you obturator nerve comes through the canal here, right? As soon as it comes here, it comes to which part of the thigh? Medial part of the thigh. So all the adductor group of muscles are supplied by
Obturator.
obturator. Got it? And also obturator nerve gives sensation to upper part of medial part of the thigh. What is the clinical importance of obturator nerve? Waddling gait, no. Anyway, let's finish with this. So these are the important parts of this bone. Alright? Now let us go to